What do you think about two things, inversion tables and also at work sitting on a medicine ball? Is that supposed to help?
Sitting on the medicine ball. So number one, the question was, what do I think about inversion tables? So I think that's a pretty individual question. It depends on what you have going on your spine. Some people, it can be very helpful to have a little bit of traction, but other people, it can really exacerbate their symptoms. So I'd want you to come and see me first, and we could discuss your own sort of individual case. In terms of sitting on the medicine ball or one of those big sort of bouncy balls, I don't love them because as strong as you may be, you could be a professional athlete. You, over time, when you're concentrating on doing something else, you aren't going to be sitting up straight over the course of a day. So even in the course of an hour, you're going to slowly sort of slump forward because that's just the natural, we want to relax. So the best thing that you can actually do is sit up nice and straight in a hard back chair. Yeah, question?
I was going to guess that, rises and even stand at it.
Mm-hmm.
What do you think of standing most of the day rather than sitting?
I think that's a fantastic idea. If you can sort that out with your work or at home, wherever you work, it's really good for your back, like I mentioned with the pressure to stand versus sit. And especially if it's one of those adjustable ones, you can stand until you get tired and then take a break sitting down. Yeah.
When you're standing, is it a good idea to have one foot elevated, sort of, or both feet on the ground? What's a healthy stand?
So the question is it healthier to stand with 1 foot elevated, maybe up on a step, or is it healthier to stand with 2 feet on the ground? I don't really have, I think if you're going to be standing for a long period of time, standing and distributing your weight evenly on both sides is probably better. But if you do have something like spinal stenosis, which we would certainly have to discuss, then it could be beneficial for you. Yeah?
More like 3 questions in one, I guess.
Sure, okay.
Is the idea of sleeping on a firm mattress a myth, or in helping the back, or?
I have not seen any studies that tell me that sleeping on any type of mattress is better than another mattress. So what I usually tell my patients is that if you feel good when you wake up in the morning, that's probably the right mattress for you. And if you don't feel good when you wake up in the morning, it may not be your mattress, it could be your pillow. So it depends. I had someone come in the other day and she bought a side sleeper pillow. Right? So they make these special pillows for if you sleep on your back or your side or your front or whatever. And, she was using it all wrong. So she was using the big part up here and the small part down here. And what I want her to use is the larger part here so that she supports her neck and she kind of lays flat on her side. So her neck's not like this or like this all night. So it's kind of one of those things that it's pretty individual, and I can't convince myself that you spending a lot of money on a mattress is going to help your back problems.
Okay, and then 2 other questions.
Sure.
So the medication I usually take is tearing up my stomach.
Mm-hmm.
I think it's the naproxen. I'm not sure. What other alternatives? For anti-inflammatory?
Yeah.
And the second question is there such a thing as being able to prevent a recurrence of your back, the back pain coming back?
Mm-hmm. So the first question is related to anti-inflammatories, and either on ads and TV or in the drugstore you see there's a number of these different choices. So we have things like ibuprofen, Motrin, naproxen, Aleve. There's probably some other ones out there that I can't think of right now. What is it someone said? Celebrex is actually a prescription, but it is it's in the same drug category, and we have a number of other anti-inflammatory Celebrex specifically, as well as another medication called meloxicam, are a little bit easier on the stomach. But if you do have stomach problems when taking them, I'd rather have you stop them altogether, and we could find an alternative for you. You know, medications are not without risk, so whenever we're prescribing a medication or whenever you take an over-the-counter medication, it's good to sort of think to yourself, is it really worth the risk of taking this medication? Do I need it, essentially? And sorry, the second question was about the recurrence.
I mean,
so,
I feel like every couple of years,
yeah,
so I can't walk.
does back pain reoccur? Do these problems reoccur? I'd like to say that if you come to see me and we get you to a good rehab program, or you have an injection, or you take the right medication, that you're going to be sort of cured for life. But the unfortunate thing about back pain is that a lot of these things that I talked about are what we call degenerative process. So it's sort of like that gray hair of the spine that I was talking about. It's just kind of natural course of aging. And so what we do, if you do have what we call acute flares of back pain with sort of a chronic underlying condition, is manage those acute flares. And the best way to keep those acute flares from coming back is to do those things like the core strengthening, like the aerobic conditioning, and really supporting. I can't emphasize enough how much the core supports your low back. Yeah.
Hi, I teach Pilates
Okay.
in the community, and I have clients that are 26 years old all the way up to 86 years old. They have osteoporosis, they have Parkinson's disease, they have arthritis, you name it, or they just want to have great bodies. And for Pilates, the core is everything, you know. So I mean, Joseph Pilates kind of sold that from the First World War. So I have just one quick question that you can talk about neutral spine. I know that for some of my clients who have lower back pain, we go into a lot of, and he taught that too, pelvic tilts. And when you do a roll up, I always, and a roll back, I always teach pelvic tilts, especially on the roll back, because it lengthens this part of your spine and you're using your core. So
yeah, so I think that you make a good point. So in general, I think Pilates is a really great exercise, and I think that I'm very familiar with the exercises that you do in Pilates. When someone has back pain to start out with, I really want them to start with just not much forward or backward bending until they can maintain that strength. So the exercises that this lady is talking about are things that you're laying on the floor and you're rolling up to a seated position, and even going past that seated position and bending all the way forward. So for some people, those are great exercises. It's probably not something I would start with the majority of my patients.
no, I wouldn't start with it, but you would just say something about a neutral spine. And I know I would do it in a pelvic tilt because they would be resting up. And it was just
and I think maybe you and I are talking about similar concepts with the neutral spine. I think my emphasis is no real extreme bending forward or backwards. Yeah. So you guys have in your community someone you can use as a resource.
And also the plank that you were showing in my class, that's what I tell them, it's my favorite position in Pilates, is that plank on your elbows.
Good. That's my favorite. So. Yeah, back there.
With these conditions in your back, what's better for you, heat or ice?
That's a good question. You know, there's not a lot of good data on using heat or ice as a treatment, and really what we're affecting with heat or ice is the soft tissues, meaning the skin and some of the muscles. So in general, the rule is when you have acute pain, meaning it just came on suddenly, ice is the sort of general rule of thumb. If you have something that's been going on for a while, heat is usually something that people like more. But in general, if something feels good, I would do it. Yeah.
What do you think on Mackenzie method? My husband had a knee disc and he was treated with that approach, and it was good for him. And when I did it for my back pain, I didn't like it really.
Yeah.
So the kind of stretching there, pain management, the first exercise they recommend, you're probably familiar with that. recommended kind of stretch for general back pain?
So the McKenzie method that you're mentioning is a type of physical therapy that is based on your position of ease. So a lot of times it's used for people who have disc herniations, and it puts you into a position of ease, into what we call extension or backward bending. So I think that it can be very effective in some types of back pain, but I certainly don't recommend it for all my patients. Because if you remember the first diagnosis that we talked about, which is the facet arthritis, that can actually become a lot worse if you're doing that backward bending.
So that's what I was told.
Is Advil an anti-inflammatory?
It is. Yeah, Advil. Sorry, I think I missed that one earlier. Advil, Motrin, ibuprofen, Aleve, naproxen. All of those are the over-the-counter anti-inflammatories.
I have a board made up for my bed, so I can lay flat on it for my back and it hurts. And I try not to bend over so my back stays straight. Is that good?
I think that's fine if you
told me that it's good
to lay on a flat bed for.
It's a board that I have to use.
If you feel like it's comfortable and you can sleep on it, again, I think that's fine. I think, I'm not going to recommend to everyone to sleep flat on their back, but, we all move around in our sleep, and I think there was recently an article that I saw with a time-sensitive camera where someone had basically left the camera lens open all night on some people in a sleep lab, and they moved all over the place. So no matter how much you think you sleep only on your back or only on your side, you're likely moving around quite a bit. So I think, sleep is supposed to be restorative, and that's definitely a big component of getting your back pain better. But in most cases, it's the things that you do during the daytime that are going to make it worse or better.
Yeah, but it's under my mattress. It's not on top of it.
That's okay.
So mattress would be
If you feel comfortable sleeping on it, I like that. Yeah, question here.
Does stress bring back pain, so muscle spasms?
Stress is certainly a component of back pain. I think that we can't call it the only cause of back pain, but certainly stress can affect us in many ways that we don't even have any understanding about right now. So I think if you do have a chronic back problem and you have a stressful situation or a stressful couple of months, sure, you may see that your number one, stress affects your sleep. It affects probably how much exercise you're getting and maybe how much you're eating and things like that, which can all contribute to back pain. So stress.
I've had working as a nurse about 40 years of looking at patients when they do this, and to this day I find the best therapy is getting the water. And you can never pull a muscle. Just even walking, you don't have to learn how to swim. You don't have to know it, but even walking and just stretching, and it's amazing help it is for me. And also those postures that you showed. When I sleep, I put a pillow between my knees. It helps me to align my back. And I sleep every night, and every time I lie down, it's like, oh, could it feel this comfortable?
Yeah, so I think that's a great suggestion. Number one, the pillow, I think we could all try it. It's not going to hurt. If it helps you, that's great. It can also help people who have some hip pain too. But, it's all pretty individualized and depends all on how you sleep. As far as the pool exercise, I think pools are fantastic. So if you have access to a pool and you can either swim or you can walk in the water or water jog or do water aerobics, all that stuff is really good, both cardiovascular and in terms of strengthening and stretching.
I wanted to ask you, I wanted to hear about shoulder, and I'm still a little late. So I've had a few steroid injections, and having so many steroid injections in my herniated disc, and shoulders. I wanted to ask you what the next option would be for me.
So actually this is a pretty common question that we get a lot of times when people are getting steroid injections, and if I see you and you have back pain and we decide to go ahead with a steroid injection, I'm going to ask you, have you had a steroid injection into your shoulder? Have you had one into your hip? When was the last one you had? Because I'm concerned about the total amount that you have in a year. Steroids, just as I mentioned with other medications, aren't without risk. So they can be great with knocking down inflammation, but they can also affect over time our adrenal glands, things like bone health, and such as that. So in terms of your shoulder, I'd probably have to see you to see exactly what your problem is. I don't know if it has to do with the rotator cuff or the actual bones themselves or the cartilage or anything like that.
What about backpacks, briefcases on the shoulder, purses that are heavy, or they are downfall?
So I think, sort of like I recommended earlier, I think the best thing is, probably not the most fashionable thing, is a backpack, because it distributes the weight evenly among both of your shoulders. Some of them even have a strap around your belly so that it distributes some of your weight at your core as well. But I would say the least amount of stuff that you can carry on a day-to-day basis, the better.
Just the common sense.
And the best way to do it, if you do carry a shoulder bag, is to switch it from side to side. So if you always carry it on the right, try carrying it on the left a couple times, and do your best.
What do you think of acupuncture and acupressure? Well, mostly acupuncture as far as remedying some pain or problems.
So I think that, so the question is, what do I think about acupuncture in terms of pain management? I think that there are certain modalities that can be very helpful for certain people. I think that there are, I'm not particularly familiar with the acupuncture literature for back pain, but I do know that I've had patients that have had some success for it. What I always tell my patients is that if you go to acupuncture and they have sort of said, you're going to need 20 sessions before this is going to get better, then I would say that's probably not the right thing for you. If you go to acupuncture and you're feeling great after 2 or 3 sessions, I think that's great. And if that's what you want to continue, but I would, if your pain continues, I would say you should probably, number 1, see your doctor, and number 2, stop paying for it.
As far as acupuncture, I've had tons of it. You need to know who you go to. That's very, very important. There can be more damage than harm. And it's only temporarily relief. It really does not last you more than 2 days. If you come home, you might feel great, but next morning, it starts all over again.
And I'm not even going to ask about, what are those bone doctors? Chiropractors.
So, this is the same as acupuncture. So, I have a lot of patients who actually ask for this, and they want to know about what kinds of alternative things can they do besides having medication, sticking a needle in something. I think the same goes for a chiropractor. If you find someone that maybe came as a recommendation to you, and you go to them and they really help you the first time, and it makes you feel good for a day or so, symptomatically I think it's okay. But I would use caution, and also if they tell you, this is going to be something you have to keep coming back to for another 20 sessions, that's not something that, my goal is to get you better so that you don't see me anymore, right? If there's a practitioner that is wanting to see you every week, for your bank account and your well-being, would prefer that you save your money for those things. But I don't have a problem with either of those things. And probably last 2 questions.
Hi. I have had a herniated disc, and I've also been told by my doctor that I also nag. This was quite a few years ago, probably 20 years ago. It's this point. but I've also got a little bit of I'm achy. My back gets pretty achy and sore, especially if I don't get enough sleep. When I first had the herniated disc, I was at pretty much a 90-degree angle. I could not stand up. I had called a chiropractor just to see if he would even look at me, and he said, "Don't even bother. Do not go to any chiropractor if you're in that kind of shape." And he said he would not look at me, he wouldn't treat me. And I thanked him because, and quite honestly, that was the most honest thing I think anybody could have said. Because when you're talking about your spine, you don't want an adjustment that's going to jerk your back.
Right, I think that's a nice.
And I was quite appreciative of it. And I've gone to a chiropractor in the past for some neck pain, just, really nothing as catastrophic as this thing was. This was pretty cool. I ended up after 4 weeks having
So I think that's a really nice comment, and that it goes sort of with any type of alternative types or adjunctive types of treatment, is that the really good one. I work with, I get a lot of referrals from chiropractors, and I certainly, don't have a problem if my patients go back to them, and I think that especially a lot of patients who have been going to chiropractors for years, they get some good benefits from it. So it depends on kind of what works for you, and I think that the best type of chiropractors or acupuncturists sort of know their limits, just as I know my limits. I don't do surgery, so I'm not going to keep you away from the surgeon if I really think that you need surgery. I think same thing, your chiropractor or your acupuncturist shouldn't keep you away from your doctor if they think that you really need it. And then I think this gentleman,
if someone has had the scoliosis surgery, are there potential problems that person can expect? Back problems?
Sure. So scoliosis surgery, especially if it was done a long time ago, has changed a significant amount over time, and we've had a lot of great developments. But our spines were meant to move, and a lot of the scoliosis surgery makes our spine, the spine sort of more stable and not movable in certain areas. So anytime we have no movement in one area of the spine, it creates more movement at the segment above and below. So a lot of times with someone who's had either scoliosis surgery or a spinal fusion, the segment of their back that's right above or right below that area, it can develop some pathology. So certainly, but there's certain things that we can do to help you if that's the case.
We want to make a message. Well, let's